Pediatric chest X-rays, three views: frontal view, PA view, AP view. PA view shows heart more prominent. AP view shows ribs more prominent. Positions of the heart: three positions: leocardia, mesocardia, and dextrocardia. In leocardia, heart 2/3 is towards the left side of the midline. In mesocardia, heart is in midline. In dextrocardia, heart is 2/3 portion is towards the right side. Now situs soletus and situs inversus. In situs inversus, stomach is towards right side, and in situs soletus, stomach is towards left side. Other than situs soletus and situs inversus, there is dextroposition of the heart seen in other conditions. Now the size of the heart counted by the cardiothoracic ratio. Normal cardiothoracic ratio is 45 to 55%. If greater than 60% cardiothoracic ratio, it is called cardiomegaly, which is seen in the congenital heart disease and rheumatic heart disease. Less than 40% CTR seen in the severe proteinuria malnutrition, asthma, and Addison's disease. Now the contour of the heart. Heart has two borders. One is the right border, which is made up of the superior vena cava and the right atrium from above downwards, and left border made up of the aortic knuckle, pulmonary arteries, and left atrial appendages and left ventricle. Cardiothoracic ratio counted by the highest heart diameter in a chest X-ray divided by the highest internal thoracic diameter at the diaphragm level into 100. Now the cardiomegaly is a condition usually signifies a ventricular enlargement. There is a two type of condition, LV apex and RV apex. In LV apex, the apex of the heart sagging downwards. Examples: the PDA, large VSD, and severe MR. RV apex, in a apex is upward turned. RV apex with the cardiomegaly seen in TGA and without cardiomegaly seen in TOF and PS. You can remember the LV apex is seen in the midline conditions PDA and VSD. In first X-ray, we can see the apex of the heart turned downwards, so it is the LV apex X-ray. In the second X-ray, the apex of the heart turns upward, so it is the RV apex X-ray. Other things we are seen in the chest X-ray: the atrial and left atrial and straight left border seen in the mitral stenosis. Pulmonary vascularity also important into the chest X-rays. Oligomia, in which the pulmonary vascularity is decreased. In plethora, there is a pulmonary vascularity is increased. In plethora, there is a decreased pulmonary vascularity. Oligomia seen TOF and severe PS. In plethora, seen total anomalous pulmonary venous circulation and DORV. Oligomia seen into the TOF and the severe PS, and plethora seen TAPVC and DORV. Commonly asked pediatric chest X-rays are: the one is a huge cardiomegaly, second one is a VSD with severe PAH, third one is the tetralogy of Fallot, and fourth one is the lung field and other abnormalities. In lung field and abnormalities, there is a one common X-ray is a consolidation. There is a important things are shown causes in this picture. Here first X-ray is a huge cardiomegaly, second one is a VSD with severe PH, and third one is TGA and Epstein anomaly. Earlier what we discussed, the CTR and other things, RV apex and LV apex, we can apply in this X-ray. Also we apply the oligomia and plethora concept in these X-rays. Here first X-ray is the TAPVC showing the widened mediastinum due to the vertical vein draining into the azygous vein. Second X-ray is a bacterial pneumonia, and third one is a viral pneumonia. Now pleural effusion. Pleural effusion is the condition in which the liquid is accumulated into the pleural layers, parietal and visceral. In the lung fields, there are three important things are the liquid, solid and gas. Liquid and solid things are the seen in the lung fields as the whitish shadows, and the gas shadow, air shadows are seen in the blackish shadows into the lungs. Here in pleural effusion, there is a whitish shadow seen, and there is second one X-ray is the regarding the miliary mottling. Here we can see the first X-ray, there is a blackish shadow regarding the excessive air of the emphysematous lung. In second X-ray, we can see the solid white margin of the abscess round margin. There is a liquid is a clear in around between the margin, so there is a blackish shadow. So the always liquid is not a whitish shadow. Clear liquid can show the blackish shadow, and there is a pustular and other liquid can show the whitish shadow. For a whitish shadow, we can use the word radio opacity, and for the blackish shadow, we can use the word radiolucency. Here in a first X-ray, we can see the various rounded discrete shadows on the X-ray of the chest. There is a differential diagnosis given below. Coin lesions, also known as solitary pulmonary nodules. Now, second X-ray shows the congenital cystic adenomatoid malformation. We need to differentiate CCAM from the diaphragmatic hernia. Here in first X-ray we can see the diaphragmatic hernia. In second X-ray we can see the duodenal atresia, double bubble appearance. There is a single bubble appearance shows into the congenital hypertrophic obstructive pyloric stenosis. Here we can see the first X-ray of the tracheoesophageal fistula and second one of the hemolytic anemia type is thalassemia. In thalassemia there is extramedullary erythropoiesis in the flat scene. So there is a hair on end appearance in a skull radiograph in seen this X-ray of the skull. Here we can see the X-ray of the wrist and the lower limb shows the findings of the rickets. Okay. These are the X-ray findings are seen into the X-ray of the scurvy which is shown here.